Alterations in fluid and acid-base imbalance. With our body fluids, it's composed of several different things. First of all is water and chemicals. Electrolytes, which are substances that carry electrical charges when they're dissolved in fluids. Acids, that release hydrogen into the fluid. And bases, which are substances that bind with hydrogen. The purpose of these components are to regulate fluid volume and buffer the blood to keep its pH or acidity neutral. An acid-base imbalance can be life-threatening. Those imbalances can be accompanied by fluid and electrolyte imbalances. Regulation of a normal plasma pH, which is 7.35 to 7.45, that's normal, is done by carbonic acid and bicarbonate. We have chemical regulation where the body will add or remove those hydrogen ions, or organ regulation where the lungs regulate carbonic acid levels and the kidneys regulate bicarbonate levels. There's two different types of imbalances: acidosis, which is excessive accumulation of acids or excessive loss of bicarbonate in the body fluids, and alkalosis, which is excessive accumulation of bases or a loss of acid in the body fluids. Just to help you remember what happens with the pH with alkalosis and acidosis. These are the normal values that you need to be familiar with. Metabolic acidosis is from increased acids or decreased bicarbonate. It can be caused by shock, cardiac arrest, starvation, diabetic ketoacidosis, renal failure, aspirin overdose, loss of intestinal fluid, and wound drainage. In these clients, we see a deep and rapid breathing or Kussmaul's breathing, nausea, headache, flushing, abdominal pain, and weakness. We're going to treat it by eliminating the cause, replacing fluids and electrolytes, IV bicarbonate. So sodium bicarbonate is a medication that we can inject intravenously. It is classified as an electrolyte or an antacid. We use it for hyperacidity or metabolic acidosis. Contraindications, of course, are going to be alkalosis because sodium bicarbonate is considered to be a base. It interacts with dobutamine, norepinephrine, and calcium. And adverse reactions, the main one includes an irregular heartbeat. It's very important for nurses to not administer sodium bicarbonate with other medications in the same IV line. We need to be sure that we dilute it with IV administration. We need to avoid rapid IV administration except in the incidence of cardiac arrest, and assess for extravasation. We may need to administer lidocaine or hyaluronidase with it. And a mnemonic to help you with metabolic acidosis. Metabolic alkalosis will occur because of accumulated bicarbonate or decreased amount of hydrogen. It's caused by excessive bicarbonate-containing drugs, diuretic therapy, vomiting, and gastric suctioning. These clients will experience anorexia, nausea, paresthesias, confusion, hypertonic reflexes, and decreased respirations. We're going to treat it by, once again, eliminating the cause, potassium administration, and sodium chloride administration. Another mnemonic to help you with metabolic alkalosis. Respiratory acidosis can be acute or chronic, and it's caused from excessive carbonic acid and is associated with extreme respiratory insufficiency. Acute causes will include a pneumothorax, pulmonary edema, asthma, pneumonia, atelectasis, drug overdose, and head injuries. Chronic causes include those COPD issues, such as cystic fibrosis or emphysema. These clients will experience tachycardia, cyanosis, tremors, respiratory insufficiency, mental changes, chronic symptoms that include increased respirations, lethargy, and headache. They may require mechanical ventilation, airway suctioning, bronchodilators, and antibiotics. Your mnemonic for respiratory alkalosis. And respiratory alkalosis is due to tachypnea that causes a carbonic acid deficit. It's caused by anxiety, fear, an overactive thyroid, aspirin poisoning, and mechanical ventilation. These clients have an increased respiratory rate, lightheadedness, numbness and tingling of the fingers and toes, those paresthesias, sweating, and panic. We're going to treat it by having them rebreathe expired air. We want them to take in more of that acid, that carbon dioxide, and sedation. In other words, we're going to slow down that respiratory rate. Nurses need to report their assessment findings and monitor lab values. And I apologize, but this is your mnemonic for respiratory acidosis. I got those switched around. I apologize. So here's another mnemonic for your acid base. The Rome method helps you determine whether you have respiratory or metabolic acidosis or alkalosis. And we will be going over that in class also using the tic-tac-toe method. Again, another mnemonic for causes of alkalosis, whether it's respiratory or metabolic, and the same for acidosis. So which acid-base disturbance would be most characteristic of a narcotic overdose? So first of all, think about what is happening with a narcotic overdose. That's going to be respiratory acidosis because the narcotic overdose is slowing down that respiratory rate, and it helps us hold on to carbon dioxide. We're not blowing it off. So potassium is one medication that we may use for some of our acid-base imbalances. It is an electrolyte, and we use it to treat hypokalemia. It replaces potassium in clients that are receiving diuretics that waste potassium or lost due to vomiting, diarrhea, laxative use, or intestinal drainage, or a fistula. Complications do include nausea, vomiting, diarrhea, abdominal discomfort. It is contraindicated in severe kidney disease because with severe kidney disease, the client is not excreting potassium. They're actually holding on to it. It does interact with potassium-sparing diuretics and ACE inhibitors. Nurses should encourage clients that are taking oral dosages of potassium to take it with food or at least 8 ounces of water. If it is in a liquid form, we usually mix that in juice. We never administer potassium in a concentrated strength intravenously. When we give potassium as an IV bolus, it will depress the heart contraction, causes bradycardia and cardiac arrest. So, in other words, IV bolus potassium is never something we would give. Clients may experience burning along with the vein with IV infusion of potassium in proportion to the infusion's concentration. So if we have a strong concentration of potassium diluted in our IV fluids, it can cause burning. So we need to dilute the potassium further or slow the rate down. If the client can't tolerate the fluid, consult the physician about diluting that potassium, like I just said. Kayexalate is the other medication we'll discuss at this point, and it's what we call an anti-hyperkalemic. We use it to treat hyperkalemia. It is contraindicated in hypokalemia, which makes sense, and obstructive bowel disease. Adverse reactions include a GI bleed or necrosis, electrolyte imbalances, and metabolic alkalosis. Do not give Kayexalate to a client that has constipation or who has not yet had bowel movements following surgery. Make sure that with Kayexalate you administer other medications 3 hours before or after the administration of the Kayexalate. So managing acid-base imbalances. We need to make sure that we are very conscientiously monitoring our labs, our I's and O's, that we implement all those orders that our healthcare provider has provided, and administer CPR if necessary. With the health history, make sure that we're getting a history of renal, endocrine, especially diabetes mellitus, or respiratory disease issues. Observe for symptoms of acid-base imbalances such as very deep or rapid respirations, anxiety, confusion, dizziness, lightheadedness, seizures, and weight changes. Determine what medications the client is taking, because we know those can lead to acid-base imbalances. With the physical examination, determine responsiveness. Get the vital signs and the weight, noting the rate, depth, and rhythm of respirations. Assess the client's mental status and muscle strength. Request ABGs, those arterial blood gases, if an acid-base imbalance is suspected. And the tests that we may do would be those ABGs, those arterial blood gases, a metabolic panel, and a urinalysis. So priorities with our clients that are experiencing those acid-base imbalances would include ineffective oxygenation, impaired tissue perfusion, altered mental status, and altered fluid volume status. Complications of acid-base imbalances can include, and this is not an all-inclusive list, these issues that are listed here: respiratory failure, organ failure, shock, seizures, loss of consciousness, all the way up to and including a coma, and cardiac dysrhythmias, all the way up to and including cardiac arrest. The things that we really need to focus on when we're educating our clients include maintaining their hydration and nutrition, because we do know that these lead to acid-base imbalances. They need to learn appropriate breathing techniques. In other words, they don't want to breathe too fast or too slow, making sure they're breathing deeply enough. If they continue to have nausea, vomiting, diarrhea, or they have respiratory illnesses, all of which can lead to acid-base imbalances, make sure that they are seeing their healthcare provider regularly. And as always, they need to take their medications as prescribed.